I've had depression, well, since I was 40, so that's 26 years ago. So I've had a long period of not feeling the best and in and out of hospitals. I thought at the time when it was first mentioned to me that I would certainly try it, in the sense, try anything.
To being so depressed, you come to alive again in normal life, I have to say, in good mood, everyday's life. That was a big change to me anyway.
My depression and what I went through was much more traumatic than what I went through with ECT. It was just a simple procedure and nobody talked about it. And when you tell people you've had ECT, it's, you know, there's still that sort of, right, okay. And I don't think people know how common it is. Like, people don't know how commonly used ECT is. It just doesn't get talked about.
The first time was in the year 2000 when I had psychotic depression and I was very acutely unwell. And I'd tried a whole lot of medication and I wasn't getting better. And I was at a point where I was so depressed, but I was also so terrified and so exhausted and so lacking in hope. And and they suggested ECT and it worked for me. I can say this was, such a wonderful experience for me to come from such a dark place and get back into life with ECT. But the thing is, I don't know how it worked. I don't know how it took me from that place to a much better one. I have no understanding of that.
ECT, or electroconvulsive therapy, is a form of treatment in psychiatry that's been around now for nearly 80 years. So it involves the use of a small and carefully controlled electrical stimulus applied to the scalp whilst a patient is under general anaesthesia. That means that the person's unaware of the treatment being administered, and during the treatment itself, the stimulus is delivered for a very brief period of time, only a couple of seconds, and it induces a carefully controlled seizure.
Are we ready to go now? Okay. 1, 2, 3.
During the seizure, there's minimal physical movement because of the use of medication to reduce any motor activity from that seizure, and the patient's very carefully monitored by an anaesthetist during that treatment.
When people have a psychiatric illness such as severe depression, we know that their brain is not working normally. We know that for some reason, we don't know exactly what's happening, but we do know that it's not functioning normally. And ECT restores the brain to normal function, which means that it relieves the symptoms of severe depression, and people go back to their normal selves. They go back to their jobs, they go back to their families, and they're well.
Even after the first 2 weeks of treatment, I started to turn around. I wanted to talk again. I wanted to get excited about things again. I just wanted to be part of life again, and I hadn't felt that way for a long, long time.
ECT is most effective for that group of patients who have the most severe forms of depression. So these are people who are so severely ill that they're unable to eat or drink, and they're very likely to actually die within a few days. And for those patients who are so suicidal that keeping them safe is actually quite difficult. So for that group of patients, the success rate is in excess of 90%.
Generally speaking, each individual treatment lasts for less than 60 seconds. The anaesthetic is generally working for about 5 minutes, so a person might be asleep for 5 minutes. The treatment itself might last 60 seconds. So each treatment's actually very short. ECT, however, needs to be given over a course of treatments rather than just as a single treatment, which means that the average person will have somewhere between 6 and 12 treatments 2 or 3 times per week in order to get meaningful benefit from ECT.
I was all in my head, and I gave permission to have it, and I didn't really have any idea what it would be like. I remember sitting in the waiting room
just really scared, terrified, because I thought I was going to die, you know. So, and of course I didn't die. It was all very nice and I didn't remember any of it.
The treatments have changed quite a lot over the last few years. The basics have not changed. The basics of actually applying electrical stimulus to the head under anaesthetic have not really changed for the last 50 years. But the techniques have mainly changed because we have been able to modify the electrical stimulus. Research has been done over the last 10 to 15 years that tells us that by modifying that stimulus, we can actually produce a much more efficient electrical stimulus that will be effective in producing that seizure using a much lower dose. And that's the main breakthrough that we've had in recent years.
The whole procedure is very quick, so they're actually only asleep for a few minutes while they have the ECT. So in terms of the anaesthetic, it's very simple, straightforward, and very brief.
I was really worried, you know, of what's going to happen. And when you say that, you don't feel anything. You don't know anything. You don't feel anything in your head or in your body. But the gladness is when you wake up, you feel normal. You feel where I come from, you know.
It's not an onerous task. It doesn't hurt. There's nothing physically damaging to you. So I'm just convinced, as I said, that for my continuing good health, I think the ECT is what's made the difference.
Most people wake up after the anaesthetic in an hour's time. They're up and about, getting on with their day and wondering what the fuss was all about.
My first experience of it was I came to picking him up after treatment, and I could see that, yes, he was a little bit foggy and he asked questions. And then as the day wore on, he felt so much better and he was a lot calmer and happier.
All medical treatments, of course, carry some risk, and every general anaesthetic carries some risk, but the risks are extremely small.
So we want to make sure that the person's as physically well as possible before they undertake the procedure. We do a series of blood tests, an ECG to make sure that the heart's okay, any other physical investigations that are needed to make sure that they're really well before we proceed.
The main problem with the ECT are the side effects on memory. There are two kinds of memory effect that can occur with ECT. One is short-term memory and the other is long-term memory. With short-term memory, people tend to get a little bit forgetful from day to day about what's been happening in the previous day or so.
What I've realised now is that particularly the long period that I had in the hospital, it's during that time that I really can't remember things that have happened since, or actually before I was admitted.
That type of memory loss tends to resolve within a month or two of stopping ECT, and some people report that their memory is better than before ECT because their depression has been treated.
The other main memory problem is called retrograde or long-term memory. And people can have the problem of losing some long-term memory, memories that have already been laid down over the previous year or maybe a bit longer. Things like forgetting a PIN number, a phone number, maybe a recipe or where you keep something at home. These are things that can be relearned, of course, but it's always wise for people to note those things down before they have treatment. But people can sometimes also notice that they've lost memory for certain personal events, such as a family gathering or a person they've met or a dinner out that they've had. And sometimes some of those things won't come back.
You know, it came at a cost, but I'm prepared to take the cost of, you know, some memory loss and some cognitive issues to have a life. Now I've got a life, so it's important to me.
Much of the research that's been done in the use of ECT over the last 20 years has been focused on trying to reduce the risk of those sort of cognitive side effects, and there have been very significant advances made in that field. ECT is given with the informed consent of the patient. What we mean by that is that patients must demonstrate that they understand the nature of the treatment, what's actually involved in receiving ECT, the potential benefits of that treatment, and the risks of the treatment as well. They also need to be informed of alternative treatment options that they might like to take up. They have the opportunity to ask for further medical opinions or for legal advice in relation to the consent. And very importantly, they have the right to withdraw their consent at any time. So even if you do give consent to having ECT, it's entirely acceptable for you to withdraw consent at any point during that treatment.
Now, some patients who with their illness are so unwell that it's really not possible for them to understand what the treatment involves and not really able to make a free assessment for themselves. Fortunately, the Mental Health Act allows those people to be seen by the Mental Health Tribunal, and the Mental Health Tribunal can give permission for ECT on their behalf. Those people, of course, would normally be involuntary patients in a specialised mental health unit.
If someone doesn't want to have ECT, perhaps because they're worried about side effects, then consideration for the risk of suicide and dehydration should be made, and a discussion with your family and with your treating team is advised. Only the Mental Health Review Tribunal or the person themselves can give consent for ECT.
Did ECT work for you?
No.
You're in a better place now, are you?
Oh my God, yeah. I don't know how I did it. It was just a matter of persistence, yeah. And I think having a network of people around you, like friends and family. I went through a lot of meds, a change in lifestyle, a change in even diet. I became a fan of meditation as well.
There are alternative treatments to ECT. Broadly speaking, those might include medication, they might include psychological treatment, or there are now other forms of brain stimulation that can be used to treat depression. It remains, though, that ECT is the most effective form of treatment for severe depression.
And I do reassure people who are suffering from severe depression that they are suffering from an illness which is treatable and that we can get them better and that they should feel optimistic that they will recover and get back to their normal lives.
The general view of ECT is one that has real no understanding at all. 2 weeks ago, I was talking to somebody with whom I've worked. When I told her I was having ECT, she said, "Oh no, not shock treatment."
There's a lot of fear in the community about ECT, and it's been a highly stigmatised treatment over the years. I think that's partly because of the way it's portrayed in movies, and it's often portrayed as a treatment that's used to control bad behaviour rather than a treatment for severe mental illness.
My first reaction when I heard about it was horror, was genuine fear, was that she could die, that she could, be lost to us forever. It was really frightening because every thought you imagine about ACT is what you've seen in horror movies or frightening scenes in films. So it was really scary.
People are often frightened of ECT because they fear that it will firstly cause brain damage, and that's not possible. There are many studies now that have shown quite conclusively that ECT will not cause brain damage. In fact, the dose of electricity that we use is so small that it can't harm human tissue.
I often work with people from different backgrounds, culturally and linguistically diverse backgrounds. And it can be difficult sometimes to explain to them the nature of ECT because perhaps we need to use an interpreter and we're not sure whether the information is being conveyed exactly as we would like it to. It can also be difficult because people have different expectations and different stigma attached to different treatments, and that can be difficult to break through. And many of the populations that I speak to automatically consent to treatments because it's coming from a medical professional, and so some of that informed consent process can be lost. So it's important that people understand really the nature of ECT, why we're using it and what the risks and benefits are.
I just think we need some respectful dialogue together and get to a place where we have talked about it so people can say, okay, I'm informed about that.
I think the best advice is to make sure you get an opportunity for a really informed decision. So not about what the benefits are, but what the costs might be too, so that, you know, and I think exposure for people of what ECT is like these days, to get exposure to that rather than images from the past.